each of our candidates roughly about 7 minutes, 1 minute to introduce themselves, 3 minutes for 2 questions. We are also here today, many people are sharing their stories about accessing healthcare. We're talking about different types of healthcare and different communities that Planned Parenthood serves. And we're out here because we advocate for access to Planned Parenthood and all reproductive health care, including our affiliates, our local affiliate, Planned Parenthood Gulf Coast, that's been in the, along with our other Planned Parenthoods, that's been in Texas for over 80 years and operates 40 health centers in the state and serves 120,000 Texans a year. So with that, we're going to kick off. Is it Anna or Anna?
It's Anna.
Hi, Anna. Thank you for being here. You have a minute to introduce yourself.
Thank you so much to both of you, Diana and Emma and Planned Parenthood, for putting this together. I think this is part of demystifying discussions about abortion and healthcare. I am excited to be running for House District 148. I served as an HISD school board member for 8 years, and I worked before that with the community advisory group at the UT School of Public Health in the pregnancy prevention program, and also worked as a trustee to ensure our kids had access to evidence-based sex ed and that we had a fully inclusive non-discrimination policy at the district. And then I will go ahead and let you ask me the questions.
In what ways have you shown support for and been involved in the fight for expanded reproductive justice and healthcare access here in Texas? And how have these issues impacted you personally through the experiences that have shaped your perspective?
So I've done everything from attended Planned Parenthood lunches, marched in the Pride Parade with my kids with Planned Parenthood, to starting out, I have a master's in social work. I went to Our Lady of the Lake University in San Antonio, which is Catholic University, and I did my practicum with children and families who had been impacted by HIV, and started out really early in a Catholic setting, insisting that we were able to talk about condom distribution on the campus. It was shocking in a social work program that we were not allowed to do that. In 2008, I believe, as a mom of 3 young kids, I read an op-ed in the paper by Susan Tortolero about teen pregnancy rates in Texas. And I reached out to her and I joined the community advisory group I mentioned earlier. And I became actively involved in ensuring our kids had access to evidence-based sex ed, that we were working with Planned Parenthood for programs called, I think it was Real Talk, Real Life, that got families together discussing sex and sexuality and coming of age, puberty, and all those kind of things that make us squeamish, and really giving our families tools to be able to talk about things that we all naturally do. As a school board trustee, I was able to vote on keeping evidence-based sex ed in our schools. I also had a very specific situation where one of our high school students tried to access information about Planned Parenthood Advocacy Day, and she was blocked from accessing it on her computer. She reached out to the chairman of the board at Planned Parenthood, and it went viral that HISD was keeping this from kids. I was able to talk to our IT people. It turns out that we had removed those blocks, but when the programs would upgrade, they would automatically go back in place. So we were able to quickly get rid of that and ensure that our high school students actually had access not only to advocacy information, but also to medical health information. I could say other things. I've also been really active in gender infinity and advocating for the trans community, and I believe passionately that when we have human relationships and we have people that can talk about real people and real lives, we start making change. We live in this strange place that is simultaneously the most hostile and the most welcoming place.
Thank you for that response. Next question. The vast majority of Texas school districts, 83% of them in 2016, teach abstinence only or nothing at all about sex education. Many abstinence-only programs used in Texas schools suggest condoms and other contraception aren't effective. They promote dangerous stereotypes about gender and sexual assault, about gender identity and sexual assault. They ignore or even disparage the existence of LGBTQ people and ignore and distort information about abortion and common reproductive health care, which is accessed by nearly 1 in 4 women by age 45 in the United States. What is your position on state funding abstinence-only education? And do you believe that sex education should be opt-out or opt-in for parents?
I am against funding abstinence-only programs. I think it's fine to have abstinence plus, especially because I believe we should be giving kids access to this information earlier than we even are now. Kids have at their fingertips with their phones so much information that can be incredibly helpful to a kid who is discovering that they're LGBT or maybe trans, and it can also be incredibly damaging if it's misinformation. So we need to be giving them the accurate information quickly and upfront. So I oppose funding abstinence-only programs. Could you tell me the second part of the question?
The second part of the question was, do you believe that sex education should be opt-out or opt-in for parents?
So when my kids were in elementary school, HISD had a policy that we could give abuse prevention, which is very different from sex education, presentation to kids, and that we only had to notify families afterwards. It was kind of controversial because when the parents would find out that their kids had been given these lessons, they would be upset because they felt like it was disturbing their innocence. The district kept the policy intact where we give the kids the information proactively and then notify the parents. I think it should, I think we should give the kids access to the information and inform their parents. So I guess a parent always has a right to opt out for their kids, and I don't think they should have to make the decision to opt in. I think our kids are quite aware of what they're going through, and they only are more healthy and safer if they have more accurate information.
Thank you. How are we doing on time? Okay. Anything else you want to expand on? You don't have to. You don't
Go for it.
AISD right now is really kind of in the midst of this battle, and what we've seen is quite a bit of sex education being specifically zeroed in on trans people. So how would you, if elected, make sure to connect the dots in a way that makes people understand how this is all part of a comprehensive sex education plan? And how would you also help the ISDs that are really trying to get this information to students?
Well, I think we need to make sure people quickly and have accurate information about the difference between gender identity and gender expression and sexual orientation. It's, your gender identity is how you go to bed, and your sexual orientation is who you want to go to bed with. And I don't know if you need to put it that in those words actually for high school kids, but I think we need to explain the difference to people. And I think just talking about it and giving people accurate information is the best way to demystify it. I think people are uncomfortable with things that seem foreign to them, and our young people are actually, I believe, going to be the ones that take us there. They're not growing up with the rigid lanes that our parents grew up with, and even I grew up with as a 52-year-old. And so empowering kids with information to help take their parents along, and then having educated people who are confident but also compassionate when they're explaining and giving people information.
Thank you, Carol.
Thank you, Anna.
I'm so sorry because I already turned my page. Thank you,